Laser treatment of toenail fungus is one of the most advanced and effective treatment options we have available today. But one of the main questions that comes up with this treatment method is it safe? So in this video today, I'll explain the safety of laser when it comes to treating toenail fungus, who it's for, and who it's not for. My name is Dr. Tarr. I'm a board-certified podiatrist in private practice in Phoenix, Arizona, and I own this practice today that I'm recording from Direct Podiatry, Arizona in Tempe. Class 4 medical lasers, like the one I use, are FDA cleared, 510K cleared as well, and have been studied thoroughly for safety and effectiveness. So these lasers wouldn't be given this classification unless they actually did work for a large amount of the population. Laser in this example for toenail fungus treatment, the laser beam is a light that targets where the fungus actually lives, which is underneath your nail and in your nail root. And this light at specific wavelengths or energies is able to kill your toenail fungus without damaging the surrounding skin. Laser for toenail fungus is pain-free and non-invasive, and it can be a way to clear your toenail fungus without the use of medications. Even though laser therapy is very safe for most people, there are certain situations or people with certain diagnoses that are not good candidates for laser. And I like to be very upfront and honest about this because, again, patient safety is paramount. And two, if you're making the decision to use laser to treat your toenail fungus or any other foot issues that you have, you want to be sure that it will work. So groups of patients that laser treatment for toenail fungus is not for are one, those that are pregnant. There's limited research during pregnancy to show that it actually is 100% safe. So again, with most things during pregnancy, it's better to err on the side of caution. If you are pregnant, no laser treatment until after you deliver the baby. Patients with PAD, peripheral arterial disease, severe circulation problems in their feet. This is because the laser doesn't generate a ton of heat, but with people with severe vascular compromise, any type of heat or any type of changes that are done to your feet, on your feet, can lead to wounds, can lead to burns that someone with a healthy circulation to your feet would be a non-problem. So one of my mentors, Dr. Zuckerman, always says, if you wouldn't perform nail surgery on a patient, don't treat them with laser, just again, to be on the safe side. Patients with epilepsy that are triggered by flashing lights. It is possible, since laser is a light beam, that could trigger a seizure. For these patients, again, better to err on the side of caution. And people with any type of photosensitivity disorders, meaning that you're sensitive to light, or if you're taking any medication that can make your skin very sensitive to light, laser isn't for you. And this is just because your skin can mount more of a stronger reaction to the laser beam. It's so important, if you decide to go down the route of treating your toenail fungus with laser or any foot problems that you have with laser, foot pain, neuromas, plantar warts, ingrown toenails, that you be evaluated by a doctor, because again, we can go over your medical history and see if you fall into any of these categories. So what can you expect during your laser treatment? I usually do 2 minutes for the big toenail and then 1 minute for the smaller toenails. With laser for toenail fungus or any other foot issues that you might be having, you might feel a little bit of warmth once the laser is being used, but you shouldn't feel pain. If you feel pain, let the doctor know, or the healthcare professional that's performing your laser treatment. They can adjust the settings, or I can adjust the settings if you're coming here to see me, to keep you comfortable. So after your treatment session, there's no downtime. You can go back to your regular activities as normal, because it takes a longer time to kill fungus as opposed to something like a bacteria, and because your toenails grow typically very slowly, at least slower than your fingernails do. This will vary from doctor to doctor, but for me personally, I recommend 6 treatments 2 weeks apart. So you would come into my office once every 2 weeks for a quick laser session, 1 or both feet, depending on which nails are affected. And then between treatments, we're allowing just your nail to grow in. With laser treatment, or really any treatment for toenail fungus, whether it's laser or you're using pills like terbinafine, for me, it is very important that your body be as healthy as possible during this treatment. Because even though laser therapy is great, we need your immune system to mount a big enough of a immune response to clear the fungus for good. So you want to be mindful of diet, foods that are overly processed, refined sugars. You want to eliminate that or lower that as much as possible. Be mindful of your sleep, hydration as well. All these things are also important with your laser treatment to give you the best chance at success. For myself and for a lot of doctors that treat toenail fungus, because it can be a little bit more challenging, not impossible, but it takes a little bit more effort to treat toenail fungus, again, as opposed to a bacterial infection. Combination therapy is the word that we use. You want to attack your toenail fungus from a lot of different angles. And this increases the chances that you will clear your toenail fungus for good. So in addition to using laser like we're talking about today, usually I will prescribe, or other doctors will prescribe, to a topical medication that you paint on your nail, sometimes antifungal foot soaks, supplement recommendations as well, just helping support your body produce healthy nail at a faster rate. So that is it. Who is a candidate for laser treatment of toenail fungus? I have a playlist here talking about everything laser treatment for toenail fungus related. Feel free to go over that if you're interested. If you are here in Arizona or in Phoenix, Maricopa County, and you're interested in booking an appointment to treat your toenail fungus with laser, feel free to click the link in the description box to my practice website. Like, comment, subscribe, turn on that notification bell so that you can be notified whenever I post a new video. Take care and wishing you good health. Bye.